two videos this week will present concepts related to disasters and disaster planning, as well as concepts related to infectious diseases. Why link these two concepts together? It's not unusual to correlate the emergence of an infectious disease after a significant disaster occurs. Think of some recent disasters in the United States. Hurricane Katrina in 2005 comes to mind. The hurricane impacted New Orleans and left it devastated, but the effects of the disaster continued well beyond the actual storm itself. After Katrina, numerous dermatological conditions, diarrheal diseases, and respiratory diseases were associated for months after the hurricane. Note that these health problems occurred in both evacuees and rescue workers because rescue workers are affected by the same problems as the evacuees. MRSA and other skin disorders resulted in deaths. Diarrhea and vomiting resulted from norovirus and other GI toxins, and pertussis and TB caused respiratory infections. When a disaster destroys a community's ability to prevent infection, the biological agents will find a way to cause disease in humans. This chapter in the textbook marries these two concepts in order to understand how this infectious process can be stopped, whether it's during a disaster or during times of calm. This first video presents concepts related to disasters. The second video this week presents concepts related to infectious diseases. Each of these concepts has multiple subtopics to consider. Feel free to pause or stop the videos at any time and come back to them later. These videos give you the freedom to learn and understand on your own time. The two student learning outcomes to consider as you view these videos are presented here. The first should be familiar to you as you identify ANA standards of nursing practice when delivering nursing care in the event of a disaster. In other words, what roles and responsibilities are specifically assumed by community nurses that are guided by ANA standards of nursing practice in the event of a disaster. The second, analyze a community preparedness plan in relation to the role of the community nurse, will be accomplished as you complete your learning activities this week, which are to review and analyze an emergency preparedness plan. If you are a Centera employee, you will be visiting Centera's own disaster planning website on WaveNet, and you will be able to review the multiple roles and responsibilities of key personnel in the hospital setting in relation to a disaster. If you are not a Centera employee, you will be able to view a large hospital corporation's disaster plan as well, which parallels Centera's own plans because each disaster plan is based on the guidelines and regulations developed by the Federal Emergency Management Agency, or FEMA. Hospital and community systems work with FEMA to design and implement disaster plans before, during, and after disasters strike. So no matter which disaster plan you review this week, remember that it has its origins from the requirements specified by FEMA. Working in the hospital setting, you are probably accustomed to many types of medical emergencies. There are medical response teams, code blue, code red, code silvers, etc. And each emergency has a process and protocol that is known and followed in order to bring about the best outcome possible. But in every case, these are controlled emergencies, emergencies that have been anticipated and guidelines established to improve the outcome of the situation, whether it be to de-escalate an anxious family member, exterminate a fire, or revive a patient. In the community setting, emergencies occur that are both predictable and unpredictable. Emergencies are also categorized differently from those in the hospital setting. In the hospital setting, emergencies are individual situations that can be dealt with by the local immediate teams of professionals, and help in a hospital is always readily available. But in the community setting, an emergency is defined as an event that is large enough to have a major impact on community functioning. Because of the nature of these events, an organized community effort must be employed to prevent or control their impact. This usually requires multiple agencies and personnel working in a coordinated effort to address many areas in the community. A local recent emergency was the tropical storm that caused massive flooding in our area. This emergency required coordinated efforts by emergency personnel such as police, EMS, fire and rescue, as well as actions by power companies, road companies, waste removal companies, and insurance companies. There were a lot of individuals and agencies working together during and after the flooding occurred to alleviate and repair damage left by the tropical storm. But this is an example of a community emergency. It is an example of an emergency because the resources of the local community were able to manage and repair the damage done by flooding. This example demonstrates the difference between a community emergency and a community disaster. Community disasters are events that exceed the community's local capacity to manage them. There is no other health issue that has the potential to impact the total community, including the nurses who live in that community, than a disaster. Nurses, therefore, need to know essential information to enable them to respond to individual, family, and community needs related to these emergencies and disasters. Well-functioning communities always have disaster preparedness in mind to decrease the impact of disaster stress on the local environment and citizens. Depending on the type of disaster event, a community can lose all the resources found in a typical community setting, as seen here. Disasters can greatly affect a community's health and create immediate and long-term suffering and need. A local example of a community disaster was last seen in 2003 when Hurricane Isabel swept through our area. The storm knocked out power, destroyed roads and flooded neighborhoods, damaged houses, and brought our area to a standstill for many weeks. This disaster created a need for outside resources, such as insurance agencies and outside power companies. Healthy People 2020 has identified a national preparedness goal: improve the nation's ability to prevent, prepare for, respond to, and recover from a major health incidents. The overarching goals of this preparedness are to build community resiliency and to strengthen and sustain health and emergency response systems. A few terms should be defined before going on to present concepts in disaster preparedness and management. Disasters are considered sudden or serious events of such scale that there is considerable human, property, or environmental damage or loss, with resultant serious breakdowns and disruptions in community or society function, and they require exceptional efforts or outside resources for community management or recovery. Mass trauma or mass casualty incidents are terms used to indicate events that result in the deaths, injuries, disabilities, or emotional distress of many persons. A mass casualty incident typically produces more casualties than a customary response can handle. Examples include mass transit accidents, collapses of large buildings, exposures to hazardous chemicals, and other events of sufficient scale to involve numerous victims that overwhelm the usual emergency response. National preparedness plans in the United States rely on surge capacity to meet the healthcare needs during a disaster. Surge capacity is the ability of healthcare systems to quickly expand beyond customary services or capacity in order to meet emergency needs. Nurses in all settings must be prepared to encounter emergencies or disasters in their communities and are required to report to hospital systems and other health areas in order to meet the needs of the surge capacity. Disasters can be divided into two broad categories. Natural disasters are caused by environmental or natural forces. Examples of natural disasters include earthquakes, tornadoes, volcanoes, wildfires, land or mudslides, droughts, and heat waves. These are sometimes referred to as acts of God or acts of nature. Man-made or human disasters are caused by people. Examples of man-made disasters include chemical spills or explosions, nuclear or radiologic disasters, acts of conflict or war, and terrorist attacks. Human-made disasters are further divided into accidental or unintentional, or deliberate or purposeful. Healthcare organizations may experience emergencies related to interruption of normal function, overwhelming patient volume, or patients that require specific injury care or treatment, such as isolation, decontamination, or burns. What poses a healthcare disaster varies with the needs and with the available resources and capacity. Disasters have their own characteristics. It's important to understand these characteristics in order to plan for and manage the disaster after it has occurred. There are 6 elements or variables by which disasters are understood. The first is predictability. This is influenced by the type of disaster. Hurricanes have a high degree of predictability due to the immense technology available to monitor and track them. Earthquakes have a lower degree of predictability since these seem to be more random. Controllability refers to the degree to which interventions can be used to control the disaster. Dams can be used for flood control, but earthquakes are not controllable at all. Speed of onset ranges from quick, such as floods and tornadoes, to slow, such as hurricanes. Length of forewarning is just that, the period between warning and impact. In a hurricane-likely area, residents may have the luxury of a 24-hour warning. In our area, we have seen news reports of Outer Banks residents evacuating their home in the days before a hurricane is predicted to make landfall. This forewarning decreases the possibility of victims. An earthquake, on the other hand, provides no forewarning, which is why there are so many victims in the aftermath of an earthquake. Duration of impact also impacts a disaster. A tornado is only on the ground for a few minutes, but a tornado can cause immense damage and loss of life. A flood's impact can last for days or weeks, sometimes even months. The worst kind of disaster in relation to damage is one that is rapid in onset, gives no warning, and lasts a long time. Scope and intensity of impact refers to geological and social space dimensions. A tornado may be limited to a mile or two as it cuts through a community, while a flood can impact communities for hundreds of miles. Note that the scope and intensity also influence the number of individuals affected by the disaster. The larger the scope or the larger the intensity, the more that individuals are changed by the disaster. This leads to a discussion about recent local and global disasters. Tsunamis, earthquakes, floods, and nuclear meltdowns make news headlines all too regularly. Hurricane Katrina impacted New Orleans in 2005 and caused the evacuation of more than 4 million people, destroyed more than 100,000 homes and businesses, and caused more than 1,200 deaths. Following the hurricane, the levees designed to hold floodwaters were breached, which created rapid flooding of more than 80% of the city. Thousands were left without water, sanitation, or services. Those who were displaced or injured were at risk for serious health consequences, such as disease outbreaks, malnutrition, dehydration, and succumbing to their injuries or previous health conditions. From a community perspective, much of the destruction caused by natural disasters can be avoided. When analyzing the effects of a disaster, it's usually the prevention or preparedness stage of the disaster planning that it was ignored or neglected that led to the destruction. For example, here in our hurricane-heavy area, building code requires the use of hurricane clips when constructing new building and houses. This code is intended to prevent buildings from being torn apart during a hurricane. But in reviews of disasters after they have occurred, reports showed that building codes were often ignored, communities were approved and located in dangerous areas, warnings were not issued or respected, or disaster plans were unknown to community residents or were ignored by community residents. This is where you, a community nurse, plays a large role at preparing the community for disaster. Much of disaster preparedness is left to the local government and the individuals within the community. When these entities become overwhelmed, higher governmental authorities may intervene on request of the local authorities. Planning and responding to disasters must begin at the community level. Multiple organizations may be involved in disaster planning and disaster management. These organizations include healthcare, law enforcement, emergency services, first aid, financial institution, emergency shelters, faith-based groups, utility companies, and even the Postal Service. Many individual volunteers in the community also play important roles. There are 4 stages of disaster planning, and in your assignment this week, you should look for examples of these stages as you review the disaster plans. The 4 stages of prevention of disaster preparedness are prevention or mitigation, preparedness, response, and recovery. In the preparedness stage, the community plans and prepares for the event, as the event is expected, with an aim to prevent effects of the disaster. Part of this preparedness is to analyze community vulnerabilities and implement preventative activities. This stage is also used to identify community resources and capacities. Communities implement disaster education, evaluate and update procedures, and develop cooperating agreements. Just as there are mass casualty incident and code blue drills in a hospital, what happened there?
The time is 3 p.m.
Break. In the preparedness stage, the community plans and prepares for the event that is expected with the aim of prevention. Part of this preparedness is to analyze community vulnerabilities and implement preventative activities. This stage is also used to identify community resources and capacities. Communities implement disaster education, evaluate and update procedures, and develop cooperating agreements. Just as there are mass casualty incident and code blue drills in the hospital, communities plan disaster management drills and training. In our own communities around Hampton Roads, We rely on the Medical Reserve Corps to be prepared for any disaster that occurs in our area. If you are interested in volunteering as a disaster nurse, your community's Medical Reserve Corps might appeal to you. In our region, the Community Medical Reserve Corps is part of a national network of healthcare professional volunteers organized locally to improve the health and safety of their communities. The MRC network comprises 989 community-based units and almost 200,000 volunteers located throughout the United States and its territories. MRC volunteers include medical and public health professionals as well as other community members without healthcare backgrounds. MRC units engage these volunteers to strengthen public health, improve emergency response capabilities, and build community resiliency. They prepare for and respond to natural disasters such as hurricanes, blizzards, and floods, as well as emergencies that affect public health, such as disease outbreaks. They frequently contribute to community health activities that promote healthy habits. You can check out their national website at this address. The community responds to a disaster in both short and long-term activities. Communities assist with emergency plan activation, resource mobilization, establishment and maintenance of shelter, and communicate these resources to the citizenry. Community authorities also assess community damage, injuries, or needs immediately and use healthcare professionals to provide aid and assistance from within the community and request and secure other needed resources. The healthcare activities include providing nursing care to those affected by the disaster and implementation of disease surveillance, vector control, hygiene measures, and safety measures for food and water. As you can see, during the response stage, much activity and collaboration is required, and this flurry of activity demonstrates how important preparation is in the event of a disaster. As the disaster event dissipates, recovery from the event begins. In the recovery stage, authorities continue to manage and assess disaster effects and monitor community systems and services. Organizations that were involved in the disaster response meet to participate in debriefing and evaluation of the activities that occurred during the disaster. Organizations will also advocate for disaster victims and survivors and work to resume normal health services. Authorities and others participate in policy development, which further supports disaster mitigation and preparedness activities. This cyclical process occurs in the emergency management sequence, and it seeks to improve each stage of the process which could potentially impact the effects of a disaster on a community. Disaster plans should be simple, clear, flexible, and realistic, as well as easy to implement regardless of the nature and extent of the disaster or who must implement the plan. All healthcare workers should be able to locate and implement the disaster plan at their workplace. And that is exactly what you are going to do this week during your assignment, which is to locate and analyze a disaster preparedness plan of your choosing. There are numerous hospital incident command system guides available, from incident commander to scribe of events. Each individual in a disaster plan has a specific role, and you will be reviewing these positions and describing their responsibilities as part of your assignment this week. Disaster plans should be tested by disaster drills, equipment checks, and updated regularly. Have you had an opportunity to participate in a disaster drill? If you are interested in participating in mock disaster drills, the Tidewater EMS Council coordinates with multiple health agencies to publish and practice incident drills that are related to mass casualty and disasters. To find more information regarding this, visit their website at this address. As you are reviewing the Hospital Incident Command Guides this week, keep this in mind. How recently have the guidelines been updated? These incident guides may also help you to develop your own personal family disaster plans. Are you prepared the next time we have a disaster in our area? The acronym DISASTER appropriately defines and describes the disaster paradigm, which is a useful model for recognizing and managing a disaster scene. The 8 priorities are outlined in the textbook, so you are encouraged to review each of these model elements to understand what is required. As you review these elements, you should also begin to consider how you should respond as a nurse and what your role as a nurse would be in each of these activities. Part of the assignment this week is to recognize some of the problems and challenges associated with the disaster response incident guide that you reviewed, and then consider how these problems and challenges could be addressed during the preparedness stage. Many nursing skills needed in emergency or disaster situations are familiar to nurses because we've been performing these types of activities in our normal hospital work. Other skills, such as decontamination after a chemical spill, may require special knowledge and training. Depending on the disaster, nurses may function dependently, independently, or interdependently as part of the response team. Community health nurses have always played a large role in all stages of disaster planning and management. Just as there are acute care competencies that nurses must meet in order to safely and effectively care for their hospitalized patients, community health nurses must also develop competencies in disaster nursing and care. There are many disaster preparedness and management agencies in this area. Each of these agencies works with the healthcare professionals and community leaders and individual volunteers in the community to develop the competencies needed to respond to the disaster. These agencies include the Medical Reserve Corps, which was already mentioned, as well as Ready Hampton Roads, the Hampton Roads Metropolitan Medical Strike Team, and the Virginia Department of Emergency Management. If you are interested in becoming prepared for a disaster as a nurse in the community, you are encouraged to visit any one of these sites to learn more. As in any community health paradigm, the levels of prevention can be applied in disaster preparedness. At the primary prevention level, evacuation before a major storm, providing shelter to community members who are displaced by the storm, and stocking up on safe drinking water are activities that will help mitigate the effects of the disaster. Examples of secondary prevention include screening for communicable diseases or anxiety reactions among victims of the disaster. Tertiary prevention strategies include caring for persons dying from storm-related events, treating individuals severely injured by the storm, and providing rehabilitation or psychological counseling services for individuals with health-related problems. This ends this video presenting concepts related to disaster planning and management. The second video this week presents concepts related to infectious diseases.